Eating disorders are often associated with teens and young women, but they can impact people of all ages. In fact, we're seeing more older women seek treatment for disordered eating. Dr. Mallika is on call this morning with your medical news. Doc, good to see you. So how is this impacting women in their 60s and 70s, and do we know the cause?
Well, according to the New York Times, more older women are seeking treatment for eating disorders, including things like bulimia, binge eating disorder, and anorexia, which can be dangerous. Now, many have struggled since childhood, but some are newly diagnosed during menopause, when, of course, women experience another period of hormonal flux and changes in their bodies. In fact, according to the Butterfly, more than half of women experience some level of body dissatisfaction during perimenopause or menopause. Well, of course, now providers are seeing the long-term consequences of eating disorders on older bodies, including osteoporosis with an increased risk of fractures, arthritis, dental issues, and heart disease. Many women who are older are reluctant to actually get treatment. So please, if you think you have an unhealthy relationship with food or poor body image, talk to your primary care. You can get the help you need.
Doc, we're going to jump around on some topics here. Looking ahead to the fall, we might see an early resurgence of the stomach flu this year?
That's right. So, Chris, in prior years, the U.S. has seen winter outbreaks of norovirus, which, of course, is a stomach bug that causes vomiting, diarrhea, and belly cramps. But last year, the norovirus season started in October, likely due to the emergence of a new strain called GII.17. Now, new strains can find ways to evade the human immune system, causing more frequent outbreaks earlier. CDC researchers say they are closely monitoring this new norovirus strain to predict if it will hit earlier than usual again this year. Well, whenever it hits, the best way to protect yourself is to wash or sanitize your hands frequently and avoid close contact with people who are sick.
Another recent headline, singer Miley Cyrus describing her incredibly painful experience with a ruptured ovarian cyst. How common is this?
Very common. I mean, ovarian cysts are fluid-filled sacs that form in or on the ovaries, and they are common, occurring as part of the normal menstrual cycle. They usually resolve on their own, but larger or more complex cysts can actually cause sudden and severe pain if they burst open. The pain can be in the pelvis or in the back or in the side, and patients can also experience things like spotting, bloating, nausea, vomiting, and faintness. Now, most ruptured cysts are not medical emergencies, but if someone has prolonged fever, vomiting, or lightheadedness, then they should be seen. The condition is usually treated simply with pain relievers and rest, but in rare cases, a patient may need hospitalization, IV fluids, even a blood transfusion, and/or surgery.
And while we're on the subject, a new study may have identified a root cause of ovarian cancer.
Yes, that's actually a special type of stem cell. It was researchers at the University of Pittsburgh who discovered that high-risk mesenchymal stem cells can help trigger precancerous growths to form in fallopian tubes, then travel to the ovaries and transform into cancerous tumors. They say these stem cells may act as supportive soil for cancers to grow, and they hope that this discovery could lead to blood or fluid tests that could detect ovarian cancer earlier than doctors can do it now.
Dr. Mallika, thank you for joining us. And Dr. Mallika is on call with us every Monday, and you can find all of her interviews on our website, cbsnewyork.com.